Anderson. I'm going to talk to you about diabetes in pregnancy. All women are checked for diabetes in pregnancy. We typically check women between 24 and 28 weeks of pregnancy. The placenta is a diabetogenic organ. So in other words, all pregnant women have a tendency to become diabetic in pregnancy. And so between 24 and 28 weeks, we do a test called a 1-hour glucose tolerance test. And that test consists of giving you a drink of either orange or cola flavored glucose. And you do not have to be fasting for this. You can have a regular meal beforehand, and then approximately 1 hour ahead of time you stop eating and drinking, drink the glucose, and then 1 hour after drinking the glucose, you have your blood drawn. Now if that test level comes back elevated, then we go on to what's called a 3-hour glucose test. The 1-hour test is a screening test. The 3-hour test is a definitive test. The 3-hour glucose test is done by drinking 100 grams of the glucose drink. You need to be fasting for at least 6 hours before doing the test. The first blood draw is done fasting. The second blood draw is done 1 hour after drinking the glucose drink, then again at 2 hours after the drink, and then again at 3 hours after the drink. So you're going to be at the lab for quite some time. So plan accordingly. Now, if 2 of those levels come back elevated, then you are called gestational diabetic. The treatment for gestational diabetes is diet, exercise, and then at times we'll need to give you diabetic medications and possibly insulin injections. The diabetic medications may be an oral tablet, or again the diabetic insulin injections that you give into your abdomen. If you are gestational diabetic, you'll have to have your finger stuck 4 times a day. You'll stick your finger once in the morning, fasting, before you've had anything to eat or drink, and then you'll also stick your finger either 1 hour or 2 hours after you've had food. So 1 to 2 hours after breakfast, 1 to 2 hours after lunch, 1 to 2 hours after supper. And if those levels are elevated consistently, that's when you will start your medications. Implications to the baby. Because of diabetes, the baby can become large, which can cause birth trauma. It also becomes more difficult for vaginal delivery. The baby can have problems keeping his or her sugar up after delivery. The baby reacts to the mother's insulin, and therefore when the baby's delivered, the baby's sugars can drop. We can also have an increased risk of the mother becoming preeclamptic or have blood pressure problems. The placenta can break down sooner. So there's several implications for a baby and a mother with uncontrolled diabetes. The mother will also have a higher risk of having diabetes later on in life. So the risks of not controlling your blood sugar are quite significant.